Welcome. We at Regional Psychological Services are most satisfied that you listening to this particular CD that we put together as part of the overall program, a comprehensive program to help your child be in control of self. On this particular one, this is Dr. John Braccio, a fully licensed psychologist in Michigan and director of Regional Psychological Services and the Attention Deficit Disorders Diagnostic Center, I'm here to talk to you just some general discussion about children, about particular things that can be helpful in the schools. And joining me here is somebody with the same name. His name is John Braccio. He has a master's and a specialist from Barry University in Miami, is now finishing a PhD in clinical psychology, and is currently working in the Miami-Dade public schools as a school psychologist. So what we're just going to do here is just kind of talk about just general questions that might come up, and mainly a lot of this coming from what happens in the public schools. So John, let me just ask you, what would be a typical set of questions from parents, or maybe another way to put it, if a parent wants an assessment that's going to relate to the characteristics of ADHD, and let me just briefly again, even though I've done this before in other sections of this program, technically the definition on ADHD, it's attention deficit hyperactivity disorder with three parts, three separate definitions actually. There's attention deficit disorder predominantly inattentive. There's attention deficit disorder with hyperactivity and impulsivity. And then there is the combined. So there's actually three types. But if a mother or a father or both just wanted some type of evaluation, even if they didn't even know what they were looking for, but that had some of the characteristics that we think of with ADHD, what would they do? I mean, how would they write a referral? How might you become involved? What's the process?
Well, typically when I become involved in cases like this, it's typically the hyperactivity subtype, because that's usually the cases in which the negative behaviors are manifesting themselves more predominantly in the classrooms, and the kid is becoming more of a distraction in the classroom in regards to talking out in class, getting out of his seat, disrupting other kids, not being able to get his work done, and not being able to accomplish the tasks that the teachers have set for the classroom. So they're becoming a disruption both in school and at home in regards to behavior. So when they come to me in the schools, typically their primary concern is, what are we going to do? What can we do to modify the behaviors that little Chucky is having inside the classroom? And then there's discussions in regards to developing behavior intervention plans, and there's discussions with using medication. But typically medication is seen as most parents, in my experiences, as the last resort. They typically like to work right away with modifying the behavior in the classrooms within the schools.
So let me ask you, do referrals, are the parents the ones that tend to want the referrals? Is it the school persons? Who generally are the ones making referrals for intervention for children in the school setting?
Both, but I would say that typically it begins more with the teachers, because the teachers seem to have the concerns firsthand, and they want to be able to help solve the problem within their classrooms, and then the parents who are concerned will come to me as well.
Okay, now when you do a typical evaluation, now one thing you mentioned, some of the behaviors you talked about, the acting out, maybe being destructive, being disruptive, these aren't necessarily the hallmarks of attention deficit disorder. Those go a little beyond. In fact, those would fit more into oppositional defiant, would they not, in conduct disorders?
Yes, they would, and a lot of those behaviors are going to overlap. You're going to see a lot of comorbidity with the conduct disorders. Many of the ADD, ADHD children develop a lot of those types of behaviors, and even develop the criteria to qualify for that. But typically in the classroom, those are the types of behaviors that seem to come to the psychologist more often as reasons for referral with ADHD children.
And that's also true in the private sector with evaluation. I just think that's an important point, because it's really typical for someone to call and say, well, Chucky or Mary, just breaks things, takes things, is destructive, fights on the playground. My kid I know has ADHD or ADD. To which I'll say, well, your child may have ADHD, but those also sound like characteristics of other disorders. And it's also true that the person with ADD who can't pay attention, that is having a lot of problems attending, shifting from one activity to another, that these persons then often do develop other characteristics in terms of the acting on. They also, if they have poor impulse control, they're going to run into these other characteristics, other diagnoses. So I think that's really a good point. But I think for parents it's important not to be upset or frustrated if someone says your son has a conduct disorder, which you say, well, my son has a ADHD, to which you can say, well, yes, your child does have ADHD. However, these acting out destructive, defiant type behaviors, if those are in place, those are not ADHD characteristics. They may result from, they can be directly related, but they are really, as John was talking about, they're comorbid or comorbidity in terms of having more than one specific type of a diagnosis. Now, as far as the schools are concerned, John, do you feel school personnel are pretty well educated or aware of the definition of ADHD? And by the way, we'll probably use some of these words interchangeably, ADD and ADHD, so because these words tend to have in the street, if you will, around the street, ADD is seen as being just with the inattentive, ADHD is with the hyperactivity. But what do you feel about the awareness of school officials?
I think that there is some confusion in regards to what ADHD actually is. I think a lot of times teachers and other school personnel will see acting out behavior as being equivalent to ADHD, and that may not necessarily be the case. As we previously discussed, ADHD is it's a disorder or syndrome that's comorbid with a lot of other disorders, which, for example, conduct disorder. So I think there is some confusion within the school system as to exactly what ADHD, ADD type behaviors are, and there is confusion as to whether or not just simply acting out equals ADHD.
Another typical concern I hear from parents, and again, I'm kind of at the other end more in terms of the private sector. If I'm giving talks, in fact, I just talked to a CHAD group here recently, here in the greater Lansing, Michigan area, and that's a question that comes up: medication. And the thing that's interesting is how people are different. You have parents that disagree. You have one parent who wants to use medication, another one who does not. But the concern often is that at least the parents' view is that the school, the teacher, is pushing medication. Now, have you found that to be the case? And I don't mean to single out a teacher or anything, but have you found as a whole that is a recommendation given to parents way before a diagnosis has been done?
I wouldn't necessarily say that it's an outright recommendation, but I would say that on occasion there will be situations where it's subtly suggested that it may be a good idea to pursue medication.
Well, let's just hypothesize here. Let's just say you're at a meeting at school and Chucky is just had one of his days, okay, if you will, or Mary, maybe the duo, okay, if you will. They've both done a lot of these activities that are very difficult. And if you're a classroom teacher, it can be very difficult, I might add. There you are trying to teach, and you have a child or two that just can't focus, and there they are just getting in trouble or doing whatever they might be. But what do? There you are, you're sitting in a meeting, you're giving input, okay, and let's just say the teacher and the principal just feel, well, now that we know that Chucky and Mary have ADHD, when do we start the medication? Now, what do you do in a case like that? And I'm not saying this happens a lot. In fact, it worked the other way. The parent is saying, okay, let's get the medication going. How do you deal with that? And maybe in a case where everybody says, yeah, let's just get that old magic pill and let's get out there and put them on it. What do you do then? What advice do you give them?
Well, I think the word that you use are magic pill. I think a lot of times parents and teachers want to see that medication is the magic wand that will magically cure Chucky, and that they don't need to do anything else. And that's really such a misconception. There are several components in treating ADHD. There has to be some type of intervention structure set in place both within the school and at home. You can never look upon medication as being the cure-all magic wand to cure Chucky's problems. And I think that's something that sometimes is missed in treating ADHD with medication, that you forget other important components that need to be put in place to help Chucky with dealing with the symptomology of ADD.
Well, let me just argue the point, and I'll say, well, Mr. Braccio, I mean, that's a good point you're saying there. However, I just read right here, 70 to 80% of ADHD children that take the stimulants, that they get better. I mean, why don't we let's just try it and see what happens? Why not? You wouldn't be opposed to that, would you? Would you be opposed to that?
Well, I think that's a good point. That shows it demonstrates how effective the stimulants can be. But you still need to have behavioral interventions set in place that specifically deal with the acting out behaviors that are being exhibited within the classroom, within the home, whatever environments these behaviors are manifesting themselves.
I think that's true. I believe, and we're psychologists, I might add, but I think it's very safe to say that medication is not a first choice. It is a second choice and a third choice. I mean, it is something we would consider anyway. And this, by the way, is done by an MD, a DO, and normally this would be the family physician, the pediatrician, and the psychiatrist. Those are the typical trio of physicians that are prescribing medications for the children, when that's specifically the age group that we're talking about here. But it's difficult when you have people, and often school and the parents, that might feel, let's just start here. And then I think as an advocate for talking to parents, we want to encourage parents to certainly try to look at other factors and other strategies that might be done. Now, John, as far as in a meeting, let's say we're at a meeting here, and let's say that the child may be inattentive, the child may be distracted, but let's just say the behaviors in the classroom really are far beyond what we think of as the ADHD example. We have the child there who's just acting out, who's just the class clown, who just won't pay attention, seems to be attending to everything. And that's another thing. I mentioned this earlier in this series, but I want to mention it again. In a way, attention deficit is actually it's a misnomer in a way, because these persons, they actually relate to everything. They can be part of 2-3 conversations. They can hear the bird. They can hear the scratch on the table. They can hear the symphony, the different orchestration, the different sounds within it. In a way, they attend to everything, and that is the problem. So when we talk about attention deficit disorder or attention deficit hyperactivity, impulsivity, what we're really talking about are people that can't easily attend to 1 or 2 things. They actually attend to everything, and of course that becomes issue. But what do we do here with the child that is doing all these other behaviors? What are just some ideas that would be given to the teacher or the parents in the meeting at school? What would be typical advice?
Well, I think when those type of severe cases, it becomes very important that that parental involvement becomes very strong. Because I think then at this point you need to have a strong home component as well as a school component, creating reinforcers to reinforce the positive behaviors that occur with the child, because the negative behaviors are clearly overwhelming everything at this point. So it becomes very important to set up specific behavior interventions plans that target first you want to target the most significant behaviors and then work your way down.
Now, as a school psychologist, are you encouraged to do this?
We are encouraged to do this. However, there becomes now we were talking earlier about the subtleties of recommending medications. When it gets this severe, subtly it's recommended that medication become a more pronounced option in the treatment of the individual.
Now, and I just to give a little promotion here for medication, not that we're saying that's not a first choice. I recently was evaluating a child, okay, and the mother first brought him in on a Saturday without medication, okay, and he was really all over the room. I mean, he really had tremendous trouble attending. And then she brought him in again, and she just said that he was really, and these were a Saturday morning, she just said was just so difficult this morning that I gave him the Ritalin before he came here, Dr. Braccio. And I said, oh, well, that's fine. Well, I've got to tell you, it was a different person. I mean, it was a totally different person. Came in relaxed, calm, could sit there and do the work. So on the one hand, we're making it a last choice, but I think it's important to recognize that it can be very, very helpful. Now, let me ask you another question. Okay, you're at a meeting now, and let's just assume for a minute that we've had a pediatrician involved, we've done a full evaluation, there's been a life history developed, we've had a counselor, everything has been gone through, all the information, and at this point, that appears to be the last real viable choice to try. Everything has worked, the child is still having problems, and even could end up in a classroom for the emotionally impaired, just cannot really behave. Good kid doesn't mean to do it, but just is so impulsive and hyper that just can't behave in the classroom. What do you tell the parent? But then a parent says, nope, I'm never am I going to deal with medication. Chucky just needs to learn to behave like I did. Okay. What do you do in a case like that?
On those types of cases, if the parent is that adamant, then you have to work within the confines of which you have. You have to work within the school and be able to have willing participants in plans. So oftentimes these plans that are set in place to modify behavior aren't faithfully followed, and at this point it becomes very, very imperative that whatever plans are developed to structure the environment, to work with the individual target behaviors that are being exhibited within the school environment are really dealt with, and that both the home and the school components of these plans are very faithfully followed and put through.
I think a key thing, and again this fits back to what we've been talking about, having the school and the home on the same page. And this is very, very important. And with difficult children, this makes for situations difficult for parents, difficult for children, difficult for everyone, even the neighborhood, call it whatever you will. So it is important to try to have everyone working in a positive way, the same direction. It's just not always easy to do, because it's just not always that easy to have everybody going the same way. Okay, now as far as a situation, let's take another situation. These are related to, you're the school psychologist. Let's just say that Chucky doesn't meet the definition of ADHD. He may have some of the characteristics. He may be somewhat inattentive. He may lose things, may do a lot of different things, but it could be something different. Person could be cognitively impaired, meaning have a lower intellectual level. Person could have a learning disorder, because there's a lot of comorbidity here. Person could have a learning disorder as a primary problem. The person could be depressed. Okay, depression can lead to inattention. So you can have some of these characteristics and not be ADHD. In a case like that, and the parent is there, and you're talking with the parent, how do you present that to the parent? You say, okay, your child does have some of these characteristics, but we're really looking much more, call it a learning disability, call it a learning disorder. How do you approach that in a way, and particularly if it might be sensitive to the parent, and they, in their own mind, they're more satisfied, they have come to the conclusion their child definitely has ADHD, and the person doesn't really quite fit the diagnosis. What do you do in a case like that, John?
I think in those types of situations it's very important to be very upfront and be very honest. You had mentioned previously that a lot of the conduct disorder, that a lot of children who are conduct disorder, parents want to believe, teachers want to believe that it's more ADHD than it is a conduct disorder. But I think if you are focusing on something that may not necessarily be there, you're really doing a disservice to the child. If the child's problem is really more of a learning disorder, if it's more depression, but you want to focus on ADHD for whatever reason, because maybe you think it sounds better than being a conduct disorder, than being depressed, then you really aren't focusing on what the main problem is. If Chucky has a learning disorder, he may have some of the characteristics of ADHD, but if you don't focus on what he really needs, then Chucky's really not getting the services that he requires, both from the school, both from the home, from wherever he's being treated.
Okay, well, let me give you another one. Chucky's been evaluated, and Chucky clearly meets ADHD. And let's even assume Chucky's been on medication, and everything is in place. But there's very little bit of a discrepancy, very little difference between intelligence and achievement. And let's say we'll even go further. Chucky's in the 5th grade. Chucky has 120 verbal IQ, which is superior if you use the Wechsler, scale for children. And Chucky in the 5th grade is reading. He's at the 6th grade level. So all of a sudden, you're sitting there at the meeting, and the parent is saying, well, look at my boy clearly has ADHD. And then you can even ask the question, well, how does Chucky behave at home? Well, he's fine. And how does he get along? Sure, he helps people in the neighborhood. Certainly the Ritalin certainly has been helpful for him. But we feel, since we know how hard he's struggling, that he needs some extra help. And we know you school folks weren't too excited about doing the assessment, but I'm glad you did it. So we want to know what you're going to offer him right now. What are you going to do for our Chucky?
Well, the school system will look at a case like that. If he's performing adequately in the classroom, they're going to tell the parents that Chucky doesn't need any additional services, so we're going to keep the status quo. That is what the school will say in those types of situations.
You have another interesting situation under 504 of the Rehabilitation Act. You could at least argue the point that Chucky ought to be reading at the 8th grade level. So if he's not achieving commensurate with his intelligence, say of 120, which would be the superior range, that he would need some additional services. I might add, though, a problem here with Chucky, of course, is that it's supposed to be in 2 areas, not just one area. Like person would, to meet the definition, would normally have problems in school, in the home, in the community, call it what you will. So that's kind of a tough situation. And in the private sector, we run into many more of those than you do in the public sector, because a lot of parents, particularly sophisticated parents, even if they're not looking for special services from the school, they know that their child has some of these characteristics and needs services, so they will go outside of the school. And another point, too, that I think parents need to know is, unless the child is really having problems in school functioning, there often is not a need for any type of a special intervention. As my mother always said, or John, your grandmother, until we get to heaven, there's always going to be issues that we have to deal with. So, not said in an insensitive way, but sometimes if the person's doing well, it's a real tribute to the school, a real tribute to the child, and most of all, really a tribute to the parents that the person is doing well. But that really tends to be a difficult thing to deal with. Have you run into much of that over the years that you've been working as a school psychologist, John?
I would, but I would say it would be which would be consistent with what you're saying. In the school system, it's typically not going to be those type of situations. That'd be a situation that you more likely see in the private sector, because the teachers, school personnel aren't going to refer to me cases where kids are performing at grade level or above. It typically has to be not even just below average, but significantly below. And if Chucky is functioning at a 6th grade level and he's a 5th grader, typically there's really not going to be a very high chance of me coming across a case like that, unless the parents are very involved.
Well, let's turn it a little different. Let's say Chucky's reading at the 4th grade level, and he's in the 5th grade, and there might be not that much of a discrepancy age-wise or anything, but would that be something? Because the school district probably would say, well, there's not a severe enough, the word is discrepancy, there's not a severe enough problem to be offering services.
Yes, that is what the school system will say. If he's at grade level or above in most academic areas, then there is no specific need. However, if the 4th grade level, say his reading grade is a D, then he could qualify under what we call OHI, other health impaired, and then maybe there could be a pullout for that one specific class in which Chucky's having difficulty in. But again, if it's just one area functioning where he's below average, slightly below average, typically it's not going to come across my desk.
Okay. Well, let's have another one here. In fact, I think let's say Mary. We'll say in this case, let's say the person is having some problems, not functioning up to grade level, but does not meet the definition of the school. many school districts have reading recovery, they have reading programs, they have pullouts where they do help. So I think as a parent, if you have a child that you know is ADHD, it certainly meets the characteristics, but you're also aware that the child will not meet the school definition for services, there's nothing to say that you cannot request some type of services in the school, and that's where that can be helpful, and that's where you can meet with the counselor, you can meet with a psychologist, you can meet with the principal. Now, John, are you aware, we'll just take Dade County since we're talking about it with Miami, what type of other programs, do they have any other programs you're aware for not a non-special education student? I mean, are these system-wide, or are they things within, that like the principal has in the school?
No, yeah, there's typically focused on reading. It's not going to be. They don't have necessarily a lot of the remedial type programs for say mathematics, but yeah, there are non-special ed programs in which children often get pulled out into to remediate some of their difficulties. There's after-school tutoring. So there are other areas other than special ed in which some of these difficulties can be remediated.
Okay, and I think tutoring is another thing that can happen. Unfortunately, if a person doesn't have an income, you can't necessarily do this, but a lot of parents will go, like I know here in the East Lansing area. I've done a lot of work with Sylvan over the years. Vic Pierce, just a great person. They do tremendous service, with persons. There are others. There are many, all over offering services, but that's also something to offer. But then again, if you have the parent with low income, can't afford to do that, then I think it's important for the parent, you as a parent, to talk to the principal, find out what services might be available, because one of the problems in life is if you can have a specific problem or two as a child, but the way services are offered, the desire or the need is that you have a severe discrepancy, is the word that is used. And also be aware too, another thing for parents to be aware of, in a fifth grade classroom, you're going to have a wide range of achievement. Not everybody comes in at like if you're a fifth grader, if Mary's the fifth grader and is achieving at the fourth grade, you're going to have in a classroom, you're going to have 2-3 year variance on each side. And a good school system offers services where the child is available. Is this anything you ever talk about with parents?
I think that's a very good point, because a lot of times, you mentioned before, Mary is performing at a fourth grade level. Now, if you look at the average range in the classroom is going to be, say, just for example, I'll throw numbers out, fifth grade, the average range will be third grade to seventh grade within the classroom. Then if you're outside of that range, say first grade, second grade, eighth grade, ninth grade, then you would be outside of the average range. But you're talking about a several year range within the average range, and I think a lot of times that can be confusing to both parents and teachers, because they think either you're being right at fifth grade level is considered the average range, and that's really not necessarily true.
I'll give you another example where there's confusion, and it relates to standard scores. Okay, like over the years I use the Woodcock-Johnson a lot. Okay, this is an achievement test, and I believe you use that also. Yes. Do you not, John? Yes. Okay. Mm-hmm. Now, let's just say that a person has 100 IQ. Let's say average, okay? And remember, IQs are really forms of achievement, and I see them as floors rather than ceilings, meaning the more you learn, the better you're going to do, certainly on information and similarities and comprehension, vocabulary, things like that. Okay, but so we have an average IQ, and let's say we have a standard score of, I don't know, let's say 85. Just as an example, okay? And the 85 is going to be one standard deviation, 15 points. We don't want to get too technical here. But one standard deviation below the mean, and like in this case, the 100 would be what we're looking at, 85 would be one standard deviation lower, okay? Now, the school district can say, well, that doesn't meet our standard of a discrepancy, but if you look at the achievement, that might be a year below grade level, okay? So that leads to some confusion. Have you ever run into that with a parent or anything, or how do you explain that? There is a lot of confusion within that, because, for example, you'll get a score of a 90, and then you'll look over at the grade equivalent, and for a fifth grader, a grade equivalent it may be, say, 3.7, seventh month of third grade. The percentile rank may be 35, and
when you look at those numbers, you're going to think to yourself, well, obviously Mary's performing significantly below grade level. She's almost a year and a half below. And I think it's very important to look at the standard score, look at average ranges. Now that 90, where it's the 35th percentile, and I don't know that, I'm just throwing that number out,
sure.
And the grade equivalent of 3.7, I think it's important that you look at that standard score and look, well, 90 to 110 is the average range. She is at the average range compared to her age-related peers, whereas the grade equivalents and some of those other numbers, the percentiles, can be very confusing and very misleading at times. And I think it's important that you look at that 90 to 110, just for example, just throwing that number out as being the average range.
Sure, I think that's true. And now, what do you do? Let's take another thing. Let's take parents. Okay, let's take parents that are a little shy. They're kind of fearful, and you're talking to them. And you come out and you say to them, or you want to say to them, or you feel they need to promote a little more for their child. Like, let's say you're aware of a person that's having some problems, and for whatever the reason, there's been no push for an assessment, no push to get something done. And you don't see the parent maybe pushing enough. I don't know what word we can use for this. How do you talk to a teacher or a parent that you might just be talking to that you feel needs to advocate a little more for their child? What do you do?
I think in those type of situations, there's a lot of different types of school personnel that would be involved in helping the child. I think it'd be important for that parent to make sure that there's a consistent communication with her and the teacher, the school counselor, myself, and if I really feel that there's an additional need, an additional push, I might just flat out tell the parent, hey, we should request together a meeting with the teacher, the counselor, myself, and we can discuss the progress of your child and even determine whether or not we need to do some type of academic improvement planning, specific interventions to deal with whether we're talking about behaviors or specific classes. Because I think in those type of situations, it's very important that everyone get involved so as to make sure Mary, Chucky, whoever the child, is not left behind, and that if they do need services, that they're able to access them.
I think that's important. I believe parents are good at advocating, and don't hear me saying that parents aren't good at advocating for their children, because I really believe they are. I simply make the point, when people are not aware of the maze that you have to go through, you almost need to be a Philadelphia lawyer in order to really know how to get services. There's also nationally the CHAD group. This is a group that deals very specifically with the needs of ADHD children, and there are chapters everywhere. In fact, I just gave a talk here in Okemos, Michigan, here just recently on ADHD in terms of common questions, number of questions coming to me from parents, the type things we're talking about, right now. So I simply, you can refer them to people, you can talk to them, give them good advice, and you're all doing this within the role of the advocate for the child, which of course we're all trying to do. But I find sometimes a call that I get in my offices, a person will say, Dr. Braccio, I think my child may have ADHD. And I'll say, we'll just talk about it a little bit. And I'll say, well, have you talked to the school people? And the person will say, well, I've talked to the teacher, and the teacher said there's a few issues here, but he or she's really not sure. And I say, and I'll say, well, have you talked to the principal? And they'll say, no, I haven't talked to the principal. And I might just say, well, look, I'm more than willing to help you, more than willing to do some assessment. But you might first want to go a little more within the school, talk to the principal. And I might talk to them in terms of the characteristics. If the person, can't pay attention, loses things, highly distracted, doesn't seem to be paying attention. If I hear those are the characteristics, then I might encourage them to request, an assessment. Then if the child is not doing well in school, then that even becomes more of a rationale. Then I will refer them back to the school, even refer them to the school psychologist if I know the person in that particular district or area, because I find that can be, very, very helpful. Because again, parents, they know when there's some issues with their child, and maybe others really just are not really tuned into it that much. And I think parents often well, they can feel, I don't know, they just don't feel user friendly a lot of times too. It's really not I don't think schools do this on purpose, hopefully not. But often I'm talking to parents that just don't feel they can talk to the school people, or they feel intimidated, or they feel the teacher would recommend or say something.
I would agree with you on that. I think a lot of times the huge bureaucracy of the school system can be intimidating at times. I know where I work, there's the bureaucracy of if a ADHD case is referred to me, just the whole process of gathering paperwork, getting signatures. I mean, it can appear overwhelming at times, not just for parents, but even for school personnel. All the loops and holes that you have to go through just to do anything. And I think it can be very frustrating for parents at a lot of times when there are issues, when they are being effective advocate. Even when you're the most effective parent advocate, it can be very difficult to get things moving within the school system, just the way that things are set up.
Well, let me give you another one. Okay, this is another interesting. Maybe you've run into this. I run into it. Okay, now mind you, I also was a school psychologist for some years. It seems like a number of generations ago, having been around since 1966 as a classroom teacher. Seems like a long time. But what do? Okay, a parent's talking to you. You're the school psychologist, and you've talked to the teacher, and you really find there really are some concerns here. But you do have each parent battling each other. And this is another common situation. The parent who's battling you, and unfortunately it's often the father, okay, I'm not saying, I don't want to do a gender thing, but the father, let's say the father has ADHD also. Well, I overcame that problem. Why not? Why can't this child? Well, the person could be a very successful builder, okay, but maybe didn't even get through high school, got the GED, had trouble, said, well, if they just work hard, they'll get ahead. No need to go forward with the assessment. Then you have the parent, we'll say the mother, could be the father though, and the mother is saying, we'll just say mother for now, says, my son really needs help. My son really needs help. Teacher says that's really true. Child really needs help. But it's not enough of a problem that you can demand an intervention, okay? The child's just having, you can talk to the kid. The kid's deteriorating from an attention point of view. You see the kid trying to pay attention, just can't. Wanting to do well, coming, requesting help, and you really feel there is a need for some intervention and the need for the assessment. What do you do? How do you talk to the other parent? If the parent says, will you talk to my parent, if my husband, if we come in and meet? What do you do? What do you do in a case like that, John?
Well, I think it's very important that both parents understand. Yeah, it may be true that the father did have similar types of problems, but every case is unique. Every case is not going to be exactly the same, and I think it's very important to get that point across, because a lot of times you do come across parents who will say, "Oh, I was hyperactive. There's no reason that that little Mary can't, or Chucky, whatever, can't get through the way that I got through." And I think it's very important to get the point across that it's every case is unique. He may have been able to get through, but for whatever reason, Mary needs extra support. Mary needs extra help, whether it be in it could be a special ed classroom, it could be in one of those remedial pull-out math reading classes, any type of specific intervention. And I think it's just very important to hit that point across with teachers, with the counselor, with myself, the psychologist, just to really get across the point of how important and helpful that additional support can be. Because if that additional support isn't there, then you're going to run into issues of self-esteem. There are a lot of different other issues may manifest themselves from not appropriately dealing with what's going on.
Well, let me give you maybe not change the facts too much, but let's even assume the person didn't do well. The person may be doing well from an economic point of view, but the parent didn't do well in school, didn't do well, and basically doesn't even respect education, is mad self. Well, they didn't do anything for me, they're not doing anything for him. I know he can do well. So is really maybe defensive and resentful. Is there any way to get to a person like that, or do you just have to kind of bide your time? What do you do in a case like that? And by the way, this is very difficult. I've run into these situations myself, not so much in the schools at the time, because this is many years ago, but I run into this with parents that will call me in the private sector. What do you do in a case like that, John?
I mean, I think you're right. That's a very difficult situation, and it's a case that we come across all the time. There may be a parent that doesn't want the school to be doing anything. They may be bitter. I've had cases in which the parent is bitter that the services were given to an older sibling, and for whatever reason, the parent was very bitter and angry with how services were given to the child. But I think I think it's very important that from the school end that you do all that you can to help the parent understand that they're there to help the child. They're not there to cause problems, to cause difficulties, and to get the point across that you're trying to be helpful and in helping to deal with the situations that are being presented within the classroom, within the home, within the community, wherever the behaviors are manifesting themselves.
And it can also be an ongoing process. I think of Cato, or Scipio Africanus, the ancient Roman discussions, John, when he said, "Delenta est Carthago," Carthage must be destroyed. Okay, there are times that you have to make the point over and over again. You can't necessarily just do it one time. So if the child really continues to have problems, and one of the parents is really resistant, and it's not extreme enough that you might push a little harder, but it's an issue that you believe needs to be dealt with, then maybe periodically there can be communication.
I think that's a good point. Periodically having, I think regardless of what you're doing, it's a good idea to have periodic meetings with the school, just to ensure that there is a consistent contact established within the home and the school to monitor the progress of each individual child in the school system. I mean, regardless, I think that's a very good idea to do. And if with people who may be resistant to any help, again, that's just as helpful, just to keep hammering the point that, hey, the child is having difficulty, and maybe there needs to be more done as far as helping the child.
And I think it's important too to be aware that a lot can be done in the school without specifically having a diagnosis, because in a case like that, and this again is talked on a different one of the CDs in this program, the idea of having the child closer to the front of the room, trying to maybe have some intervention, like making sure the child has the directions in terms of what has to be done in school, getting the assignments done, emailing between the parents. There are things that can be done short of even doing the full assessment and coming up with a diagnosis. Because I think an important thing is to deal with symptoms. We don't always have to come up with a diagnosis. And I say that and I say it again. A lot of people almost seem upset if there's not enough for a specific diagnosis. And I make the point, well, first of all, these diagnoses change. They change over time. So you could be eligible now for something, not in the future, or you might not have been in the past. But the point being, the key thing is to treat the symptoms. We want to make sure we find the etiology or the cause as much as we can. Certainly you can't always do that with ADHD, but we deal with the problems, areas where they're manifested. We try to remediate, try to help, try to compensate, call it whatever you will, have the person get to the point that they can achieve as best they can, because ADHD is not something that just goes away. People may learn to compensate for them, but 50-70% of this stuff can really go on, and you have these symptoms for the rest of your life. And just as an aside, something else mentioned here, particularly when I'm dealing with a whole different set actually on adult ADHD, at this particular point, I'm doing far more assessments of adults than children in the private sector, many at the college level, Cooley Law School, Michigan State University, of persons that just are having a lot of the characteristics of the ADHD that they somehow were able to compensate in the past, and now they're really not able to deal with the huge caseloads, the readings, the things they need to do in college, so they come for assessments now. Or another group, interestingly, is often is the word I'm using, I end up assessing one of the parents if I'm assessing the child and find a diagnosis, or other children within the family. So it is really important that we be aware of, one, how these things run within families, but that the key is dealing with the symptoms and trying to come up with treatment plans that can really help the person. Now, John, let me ask you a question, because there'll be parents listening to this. There'll be others, but parents. Right now, a parent sitting home, listening to you and me talking here, and they've learned a lot. They've learned some information on these questions just in our interaction here. But what advice do you give them if they have a child? They have a child who has ADHD, and the child's struggling, but they're all working to do well for the child. What advice do you give them based on your experience over the years now as a school psychologist and as an educator, actually, also before that?
Well, I think when you're looking at the ADHD types of behaviors, I think a lot of times these children have difficulty with organizing, with planning things out, and I think what I've tried to focus on as an early intervention is establishing structure, establishing routines within the home, within the school, whatever, to get a child into a mindset of planning and organizing their activities.
Now, another question, John. Okay, that's a question for the parent sitting home, obviously. Let's talk about it specifically. Another area we can talk about within the school. What interaction? Person just sitting home now listening to us. What interaction would you want them to have with the school? Just general good advice for them, because that's the primary focus of this CD. Go ahead.
I think general good advice is that the parent and the teacher, the counselors involved, be able to establish a consistent contact within the home and the school. I think it's regardless of what direction you're going to go in regards to services, I think it's very important that a teacher and a parent establish, whether it be through email, daily report card, phone calls. I think it's very important that some type of contact be established within the home and the school to focus on what the child with their difficult areas, their good areas, their strengths, their weaknesses. I think looking at strength and what they like is just as important as the negative and the weaknesses, because a lot of times we tend to overemphasize and focus on the weaknesses, where it's just as important to look at what the child likes, what they're into, to serve as a source of motivation of helping the child with whatever difficulties they may be having.
Well, I think very good, John. I think that's true. I think as maybe a few final comments here. One, we're very happy that you've determined to listen to what we've had to say. These are just basic questions, concerns that parents have, and questions that we hear all the time. And I think if you listen to this in itself, I think it can be useful and helpful. Additionally, using the rest of the materials, the DVD and the CDs in this set, can also be very helpful to you. A key thing to remember as a parent is that your child, no one knows your child better than you do. No one knows your child better than you do. School people may know a lot, psychologists may know a lot, the family physician may know a lot, but no one knows more than you do as a parent. In your interactions with the schools, be confident, be respectful, try to do the very best that you can do, but the key thing is to have that good communication. And a lot of times, children aren't identified in the ADHD group if they just meet the predominantly inattentive, because a lot of kids just don't pay attention. They may be seen as in the ozone layer, not really tuned in, and as a result, they are seen as just not attending and not doing what they're supposed to do. And because they may attend with a Nintendo 2 or with the popular games that are out, they say, well, that person could attend. They're just not doing, they're not trying. And in cases like that, it's kind of like we punish them when they're good, as the statement goes, because what we do, because they are able to attend, sometimes we assume they can all the time, and that's really not the case with many students in school. So the main thing to do is to keep the communication open, and also be aware that many persons with ADHD have great talents. There are many high achievers within the realm of ADHD, because the ADHD person often has more energy, can stay awake many more hours than others, is a divergent thinker, a form of creativity, because they go off on tangents, can go off on 2-3 different things at the same time. So if these energies can be channeled, they can be very effective. On the other hand, when they're not, there's a much higher degree of violence, of addiction, of problems with the law, if they go the wrong way. So it's certainly critical to while they're in school and before, to make sure people are behaving well. But be aware and behaving and achieving to the highest level that they can. But be aware that there are great skills with the ADHD. Again, like I mentioned, the ability to do more things, to be creative, to be energetic, to do things. So let's maybe end this on a real positive note. But again, be confident in your communications with the schools, with the teacher, principal, and be aware that your child has been given to you, I believe, through a higher force, through God, in my opinion, to do the best that you can do for that child. And the best you can do is communicating at school, reading, learning as much as you can, taking part like in an experience like we're doing right here with you, and just do the best that you can do. And with that, I think you can have a lot of confidence. There can be a lot of tears, a lot of frustration raising children, but do not give up, and good things are going to come through a lot of hard effort. So again, we appreciate the effort. In this case, John Braccio and John Braccio, two psychologists, we appreciate your listening to what we're doing, and you can see I'm certainly proud to have my son in the same field as I am, doing the same type work and trying to do the same type of commitment in terms of trying to be helpful to others. So best of luck to you. Do not give up. Stick in there. Good things are going to happen, and feel confident in your communications with the school. So anyway, look forward to you're listening to the other materials, and again, there you can talk to the school people. There's CHAD, CHADD. There are different groups and things that can be helpful to you. So good luck to you, and the best is wished to you with your child.